What happens to your body if you ejaculate every single day? Is it harmful, helpful, or something in between? That's the question I want you to think about, not just with curiosity, but with honesty about how your daily choices affect your long-term health. Most men don't ask this question until they face a problem. A sudden drop in energy, a change in sexual performance, concerns about their prostate, or simply the realization that their habits have never been examined with real science, only hearsay. And like many things related to male health, myths usually speak louder than facts. So let's peel away the mystery. First, your prostate. This small gland tucked beneath your bladder is more important than most men ever realize. Many studies, including those discussed in books exploring male longevity and hormonal balance, reveal a consistent finding. Regular ejaculation helps flush out old seminal fluid, reduce stagnation, and support a healthier prostate environment. Think of it like clearing out a system that works best when it's moving, not sitting still. But here's where it gets interesting. While daily ejaculation supports prostate health, it doesn't magically supercharge your testosterone. In fact, testosterone remains fairly stable, regardless of how often you release. Many men assume frequent ejaculation drains masculinity, but your hormone system is smarter and more stable than that. It doesn't collapse from normal sexual activity. It adapts, it balances, it keeps you functioning. What does change, though, is your energy. And that's where many men get confused. Energy isn't about losing testosterone. It's about dopamine and recovery. Daily ejaculation can give you a quick boost, a short high, a momentary release of tension. But like any dopamine spike, the more often you chase it, the quicker it wears off. Some men feel energized afterward. Others feel drained. The secret isn't in the act itself. It's in how your nervous system responds. And for mood, the answer lies in your habits. Ejaculation releases oxytocin and prolactin, two chemicals that help your body relax. That's why so many men fall asleep more easily afterward. For men who struggle with stress, this can actually be a healthy way to unwind. But if you rely on ejaculation as your only coping mechanism, it can become a loop, temporary comfort replacing real emotional management. Now let's talk fertility. Daily ejaculation won't make you infertile, but it can change the concentration of your sperm. If you're trying to conceive, releasing every day might slightly lower your sperm count per release, though overall, health stays strong. If you're not trying to conceive, this isn't a problem at all. Your body produces millions of new sperm constantly. So what about long-term sexual function? This is where moderation matters. Ejaculating every day isn't harmful for most men, but it does require honesty. Are you doing it because you want to, or because it's become automatic? The healthiest sexual rhythm is one that aligns with your physical energy, your emotional state, and your lifestyle. When you ignore your body's signals, pushing beyond what feels good or avoiding intimacy out of fear, that's when problems begin. Books on male wellness often repeat a simple truth. Balance always wins. Not suppression, not overindulgence. Balance. If daily ejaculation feels natural to you, if you have healthy energy, stable mood, good sleep, and no pain or discomfort, your body is telling you it's functioning well. But if you notice fatigue, irritability, decreased sensitivity, or difficulty staying aroused, that's not a sign of harm. It's a sign of imbalance. Your body isn't breaking, it's communicating. So what really happens if you ejaculate every day? Your prostate stays active, your hormones stay steady, your mood may settle, your sleep may improve, your sperm count may fluctuate slightly, your energy depends on your nervous system, and your overall health depends on awareness, not avoidance. The truth is simple. Daily ejaculation isn't dangerous. What matters is why you do it, how you feel afterward, and whether it aligns with the life you want to live. Listen to your body. Pay attention to its signals, and make choices that support, not sabotage, your long-term health. Because your sexual habits aren't just physical actions. They're part of the story your body tells you every single day. And when you understand that story, you understand yourself on a far deeper level. Your prostate is a small gland, but it plays a massive role in male health. When you ejaculate, you're essentially clearing the ducts inside the prostate, flushing out old or stagnant fluid. When this fluid sits for too long, it can create pressure, discomfort, or inflammation. Many studies suggest that men who ejaculate regularly have a lower chance of developing prostate issues because the gland stays active instead of becoming sluggish. Think of it like running water through a pipe. Movement keeps it clean. Many men believe that ejaculating daily will lower testosterone or weaken their male hormones, but the body doesn't work that way. Testosterone levels rise and fall naturally throughout the day, and ejaculation doesn't cause any long-term drop. Some research shows a temporary dip for a few hours due to prolactin release, but it quickly balances out. The bigger threat to testosterone isn't ejaculation. It's poor sleep, chronic stress, excess belly fat, and lack of physical activity. Energy changes after ejaculation vary from man to man because they depend on the nervous system. For some, ejaculation brings relaxation and a refreshed feeling. For others, especially if done without emotional connection or too frequently, it can feel draining. This is because dopamine spikes sharply during sexual release, then falls. If you rely on these spikes constantly, you may feel a kind of dopamine fatigue, not from physical damage, but from overstimulation. Ejaculation triggers the release of major mood-related chemicals: oxytocin, bonding, comfort, endorphins, relief, and prolactin, relaxation. For many men, this leads to calmness, a clearer mind, and even better concentration afterward. But if ejaculation becomes the only way to cope with stress or emotional tension, the brain becomes dependent on that chemical cycle. The result? You feel okay for a moment, but long-term stress stays unaddressed. It's well known why many men fall asleep quickly after sex or masturbation. Prolactin and oxytocin naturally promote drowsiness and a sense of satisfaction. Daily ejaculation may improve sleep in some men, especially those who struggle with restlessness. However, if done late at night, with stimulating habits like watching explicit content, it can disrupt sleep instead of improving it. The act helps. The environment matters. Your body produces millions of sperm daily. When you ejaculate every day, the sperm count in each release may be slightly lower, but quality often remains strong. In fact, for men aiming to conceive, some studies recommend ejaculating frequently to ensure fresh motile sperm. But if conception is a goal, skipping a day or two can increase sperm concentration. For men not trying to have children, daily ejaculation poses no risk to fertility long term. There is no universal number that defines too much. Science emphasizes patterns, not counts. Ejaculating daily is normal for some men and excessive for others. What matters is how your body responds. Pain, fatigue, reduced sensitivity, or irritability may indicate overuse. On the other hand, going long periods without ejaculation can increase prostate congestion or lead to nocturnal emissions. The sweet spot is individual, guided by how your body feels. Your body constantly speaks through energy shifts, libido changes, mood, and physical sensations. If daily ejaculation feels natural, no pain, no drop in performance, no emotional numbness, your balance is likely healthy. But if you feel tired afterward, have difficulty maintaining desire, or feel a compulsive need to release, those signals matter. Listening to your body isn't weakness, it's wisdom. Your health improves when your habits match your physical and emotional needs.